One of the more common questions I get asked is, "Doc, which procedure is right for me?" There are a lot of things that go into making that decision. As we can see here, complication rates are higher with a gastric bypass. However, weight loss is also faster in the first year. With the lap band, complications are less, but weight loss is slower, and it does take patients a little longer to get to their goal. The sleeve falls in between on both, number of complications and weight loss. What we see on this graph is excess weight loss with the gastric bypass and with the gastric band. Weight loss with the gastric bypass is represented by the brown line, weight loss with the band, the blue line. What we can see here is that people who have had a gastric bypass lose more weight in the first year than those who have had a band. We also see that those who had a gastric bypass have their weight level off, and then they actually gain back a small amount of the weight they've lost. With the band, weight loss continues at a slow, steady pace until about 3 years, where weight loss with the band and the bypass is the same. What we're seeing with the sleeve is that it's in between these two. Weight loss in the first year is more than the band, but not quite as much as the bypass. It then levels off, and by 4 years, weight loss with all 3 procedures is the same. One of the biggest questions I get asked is, will my insurance company cover the procedure? That depends. There are a lot of different insurance companies and a lot of different policies out there. What we suggest is that you call the member services number on the back of your insurance card and ask. They can give you the latest up-to-date information about what is covered and what is not. We also suggest that you take that opportunity to ask about coinsurance and copays. That can play an important role in making your decision. If your insurance company does cover the procedure, there are some requirements that you're going to need to meet. All of the insurance companies in this area require either a 3 or 6 month medically supervised weight loss program. They also all require a psychological evaluation. Different insurance companies will have some other requirements, such as some do require a sleep study to see if you have sleep apnea, some require an evaluation by a cardiologist or an exercise evaluation. As a comprehensive program, we have all the pieces in place to help you meet your insurance company's requirements. We also have a bariatric surgery coordinator who will help you through the process of meeting the requirements. Another question that I often get asked is, when can I go back to work? That depends on which procedure you have. What we see with the gastric bypass is that a patient will come in, surgery will take about 2 to 3 hours. Most people stay in the hospital 2 nights, sometimes 3. They don't really feel like themselves for about 7 to 10 days, and they can get back to work usually in 2 to 3 weeks. With a sleeve, surgery itself normally takes about an hour and a half. It requires a 1-night stay in the hospital. Most people start feeling like themselves at about a week or so, and also get back to work in about 2 weeks. With the lap band, surgery is usually an hour or less. You do go home the same day. Most people don't feel like themselves for about 5 days or so, and again, return to work in about 2 weeks. If your job requires any heavy lifting, or if you have to be 100% when you get back to work, such as firemen, policemen, military, we will ask that you stay out of work for at least 3 to 4 weeks. Now that I've introduced our program and discussed the procedures that we offer, the next step is up to you. We need you to give us a call and make an appointment to come in and meet one of our surgeons. At this first meeting, we'll go through your medical history, do a physical exam, and answer any questions that you have so that we can help you decide which procedure is right for you. On our website is a medical history form. If you print this out and fill in the information and bring it with you, it will significantly reduce the length of your first appointment. We also encourage you to bring any family member or friend that's going to support you through this process. We'd like to meet them. It'll give them a chance to meet us, and again, answer any questions they may have. Now it's up to you. Give us a call. Let us help you get your life back.